The coronavirus is hitting the entire country very hard, but one population is especially struggling. Black Americans are dying from COVID-19 at a higher rate. Now, why is that? Well, joining me to talk about it is FRC Senior Fellow for Human Rights and Constitutional Governance, Ken Blackwell. Ken, welcome back to Washington Watch.
Hey, Tony, it's good to be with you, sir.
All right, Ken, why is the black community suffering at a greater rate when it comes to the coronavirus?
You know, the black community is no more susceptible to this disease than any other demographic, racial, or ethnic group, but they're being highly impacted when it comes to the number of deaths associated with it.
Mm-hmm.
And that's because there are more underlying conditions among the black community, like diabetes, overweight, and asthma. And that is what is making them more of a victim,
right,
in this situation.
Yeah, and I've talked about this on the program. My daughter, who is working with the COVID patients as an ER nurse, they're, now of course anecdotally, but as they see patients come through, a higher BMI rating, which overweight, underlying conditions on here on the patients that does contribute to the mortality rate. Now, let me ask you this, Ken, because I've seen I'm just beginning to see this news emerge. In fact, the White House acknowledged this week that, yes, they're beginning to see that this is a problem and they're looking into it. But then some reporters are suggesting that the federal government is concealing this information, somehow trying to make this into a racial issue. Do you see that going on?
Absolutely not. Look, let me just give you an example. About 10 days ago, I was walking. I try to do a 2 or 3 mile walk a day. And I saw 8 young black men outside playing 4-on-4 basketball. I stuck my nose into their situation and asked them, didn't they understand the stupidity of what they were doing? And they sort of looked at me and said, look, we're not going to stay in the house. I said, well, look, be smart. Why are you going to play 4-on-4 basketball when you can play a game of horse? Keep the social distance, be competitive, be outside, but not take the risk of taking that virus back into your home with your parents, your grandparents, or your siblings.
Mm-hmm.
And so, look, there's a certain amount of personal responsibility that we have. And then there is, in terms of our public education strategy, we have to put the messages into those media that these communities listen to. So we had to step up the game on radio.
Good point.
And so everybody has to be smart about this. But there's no mistaking that this disease has, in terms of fatalities, has disproportionately impacted the black community. A lot of it has to do with the density, not only of the neighborhoods, but their housing situation. It's a real challenge.
And socialization. I mean,
Right.
and that they tend to spend more time together. In fact, this is one of the issues I brought up with the pastor back in my home community that continues to meet. And while I admire the fact that he buses in about 600 or 700 kids on a normal weekend from the inner city of Baton Rouge, mostly minority children, I'm excited that he does that in normal circumstances. But most of them live with their grandmother, who would be in this high-risk category, and you're taking a disease back or a virus back to them that could be deadly. And then who's going to take care of the kids?
You're absolutely right. And the left, and in large measure, the mainstream media, they try to turn everything into a combative situation of race. This is a public health concern. It is a concern that disproportionately impacts the African American and low-income communities for a number of reasons. And we have to specify what those reasons are and tailor our strategies to meet those challenges.
Right, and a lot of it is education, just being where they are listening and having the conversation. I mean, the same is true in the white community. Many people didn't believe this was an issue, and we're still educating them that it is a threat. Ken Blackwell, as always, great to talk with you. Thanks for stopping by.
Thank you, Tony.
All right, Ken Blackwell, FRC Senior Fellow for Human Rights in Constitutional Governance. All right, popping up around the country after, a month, going into the second month of meeting restrictions, including church gatherings. Some people are starting to see this as infringement on religious freedom. One of those fights broke out in Kansas. We're going to talk about that next. Don't go away.